2 new cases of COVID-19 confirmed in Muskoka. Some locals still not getting the message about physical distancing. And giving a salute to frontline workers. All that and more coming up right now. Welcome to Cogeco News for April 6th. I'm James Bowler with what's happening in your community. And to our top story this afternoon, 2 new cases of COVID-19 confirmed in Muskoka. And this time the victims are not just in self-isolation.
So if you look at the 16 cases that occurred since I last reported on Friday, we've had 5 in the long-term care facility. We've had 4 that are hospitalized. We have 6 that are in self-isolation. 4 of these cases have been travel-related. 6 of them have been close contacts of confirmed cases. And of them all, we have 2 that are in Muskoka, and both of those are hospitalized at the Muskoka Algonquin Hospital Corporation. Dr. Teresa Tam, the Chief Public Health Officer of Canada, has indicated that what's really important is that people do their physical distancing and their hand washing and the 2-meter setback, staying at home if you can. Certainly if you're ill, staying home for the 14 days. She indicated, though, that individuals may want to wear a mask if they're in situations where they can't socially distance, they can't physically distance the 2 meters. And by masks, we're really talking about homemade cloth masks, not hospital masks, surgical masks, procedure masks, N95 masks for healthcare workers. All of those, at this time, we really need to retain for healthcare workers because of a limited supply of masks for healthcare workers at this time. They need those masks. So if people are using other masks, homemade cloth masks, they should be aware that they're not of proven value. If there is any value in them, it's more from the point of view of avoiding infecting others. If you wear one of these masks, there's the potential for droplets from you and from coughing and sneezing from you affecting other people, keeping in mind that if you're coughing and sneezing, you really need to be self-isolating at home. So the potential value of a mask is more the prevention of spread to other people. They've not been shown to really prevent respiratory viruses from coming into your airway.
And speaking of masks, Premier Doug Ford provided an update this morning on the situation with PPE masks getting blocked from coming from the U.S.
What I understand is we had 3 million masks that were stopped by U.S. officials coming out of 3M in South Dakota. I just was briefed not long ago saying that we were able to get 500,000 N95 masks moving forward. That should be released today and coming into Ontario. But we've been on this around the clock. I'm feeling, a little more confident with the conversation with the ambassador and with the conversation we had with the Deputy Prime Minister. She's working extremely hard with, Vice President Pence that seems to be handling a majority of this in the U.S. So we're grateful for anything we can get out of the U.S. And I've said right from the beginning, we're relying on the U.S. We're relying on the federal government, and I know the federal government's working hard. And we're all working around the clock on these items. So I have a little bit of optimism right now that we're going to get this resolved with the U.S. government and asking them to exempt Canada from the presidential order.
Now, masks aren't the only level of protection against COVID-19, and according to Huntsville's mayor, some still are not getting the message when it comes to physical distancing.
If you are gathering in groups of more than 5, that is now prohibited, and it is finable.
That was Huntsville's Mayor Karen Terziano in studio earlier today to record a statement on the COVID-19 crisis. Mayor Terziano says she is still getting reports of people not taking the call for physical distancing seriously.
There's so many concerns out there about the folks who aren't practicing their social distancing, and there's still a lot of concern about people who are traveling up to the area just for the weekend, then heading home again. So the travel back and forth is definitely concerning. We had a pretty nice Saturday, lots of people out gathering in parks and waterfront areas, and getting a lot of calls about that. And there is an OPP 800 number that people can call when they see things that are concerning to them. But if they go to the town website, those numbers are right there to access, so that if they see things that are concerning, they can report them. The most important thing is that it has to be all of us to stop this. And so if you have, a few that aren't doing it, it's very, very concerning to those who are. And there's nothing that says the guys who are practicing the good distancing and staying home are not going to be the ones that don't get it. So, it is very concerning. I know that one resident called me, and they were in the grocery store, and people were bumping into them with their carts, and and yet the grocery stores are being very good about trying to limit the number of people that are coming in and asking people to practice safe measures, but some just aren't doing it.
And you can catch the mayor's entire statement on our website, yourtv.tv. Well, the CEO of Muskoka Algonquin Healthcare also utilized our studio on Friday to send an update to residents. In this clip, Natalie Bubella discusses the safety measures being taken at both sites.
With the concern and potential impact of community spread, Muskoka Algonquin Healthcare has done a lot of work to put in place additional measures at Muskoka's 2 hospitals, including the following: ensuring robust infection control isolation precautions are practiced diligently everywhere and at all times. Regardless of where potential or confirmed COVID-19 patients are, these practices are in place to protect against cross-contamination of any infection. We're ensuring mask use on-site by outpatients attending essential or urgent appointments at the hospitals, as well as visitors who allowed for compassionate reasons during visiting restrictions. We continue to cancel or redirect many outpatient appointments. Our staff within a 2-meter distance of patients or those with contact to patient spaces are wearing masks as well to reduce the risk of potential transmission from anyone who could be carrying the virus but do not show the symptoms. We continue to monitor and react to a provincially challenged supply chain of personal protective equipment for our staff and physicians, and ultimately our patients. We've launched a community donations process through the leadership of the Huntsville Hospital and South Muskoka Hospital Foundations. We are ever so grateful to everyone for their overwhelming outpour of support, of gifted masks, gowns, and gloves, as well as financial support through donations.
And again, you can find Natalie's full statement on our website, yourtv.tv. Well, when we come back, another statement from another local official on the COVID-19 situation. Norm Miller joins us next. Welcome back. And joining me now is MPP Norm Miller. Thank you very much, Norm, for taking the time.
My pleasure, James.
So, Norm, we've checked in with you a few times over the past few weeks, but just wanted to do another check-in with you again. And I've got a couple of questions here based on some of the things that have been updated. Now, last Friday, the Premier had released some new details on the staggering COVID-19 numbers and what we could be looking at by the end of this month. So tell me a bit about that and, you know, how you sort of see that that has helped with this situation.
Sure. Well, the Premier, I think, was releasing numbers and being as transparent as possible, basically showing the modeling that he is seeing to try to make people aware how serious the COVID-19 threat is and different scenarios whereby if we follow instructions and keep social distancing and wash our hands and stay home, how we can make a real difference. And, you know, I think the numbers were varied greatly from, I think, 3,000 to 15,000 deaths possible, depending on what we as individuals do. So I think it's about transparency and releasing the modeling, but it's also about trying to affect change so people do take it seriously. And I think the great majority are taking it seriously, but you know, we all need to do our part. And you know, in Parry Sound, Muskoka, of course, we have a lot of seasonal residents, and so the message to the seasonal residents and to all residents, not just them, is to stay at your primary residence. Don't travel unless it's absolutely necessary, and that's been confirmed. That was the advice of the various medical officers of health, the chief medical officer of health for the country, as well as Dr. Williams for Ontario. So, you know, I think it's really important we all do our part, and then we can have a much better outcome. I think the Premier's message was we can write the end of the story, and it can be a good end if we all do our part.
Norm, one thing I wanted to bring up with you, and you know, it's been brought to our attention, and actually I saw one over the weekend as well. There's been a number of New York State and other out-of-country plates in Muskoka. I saw a New York plate literally on Sunday when I was driving on Highway 11. You know, I do understand a lot of these people may tend to winter over in Muskoka. However, I'm just curious on your response to these people that are being spotted around the area. Should they be returning home at this point? I mean, this is putting a strain on our healthcare system, according to a lot of local officials.
Yeah, so the message is stay home, and that includes anyone. And if you are returning from Florida, as a lot of our Ontario residents do, then it's a mandatory required 2-week quarantine as by the Federal Quarantine Act. So for everyone, it's stay home. It's don't travel unless absolutely necessary, and stay home. And even, you know, we've got Easter weekend and Passover coming, and it's really important that you know, as much as you might want to get together with your family for a turkey or whatever, ham or turkey, this year it's best to do it via Skype or Zoom or FaceTime or one of those methods of connecting with your family without actually being face to face.
Norm, just going back to again seeing these especially these New York plates, is there a way, and could we be possibly seeing a movement towards policing this and possibly expediting people out of the area?
So the border was actually closed. So I don't know whether these people came before the border was closed, but the border was with the United States was closed except for commercial travel required to keep food on the table and to keep goods like ventilators and other parts of the supply chain going. But for just travel, the border's closed.
All right. Well, hopefully we'll see some maybe more effective methods of pushing these people home. Moving on, the Premier had also announced on Friday a cut in the terms of what is essential business in Ontario. So I'm curious, you know, there are a lot of businesses that have closed in Muskoka and Parry Sound. Are there any further closures we could be seeing? Any businesses that are affected further by this cut?
It was certainly, I mean, the list of essential businesses went from, I believe it was in the 70s, around 74, to roughly in the 40s, around 44 businesses. And the way they do businesses has been changed. It's, you know, it's a balance. The primary thing is, of course, health and keeping people from being in close contact. So now for businesses like hardware stores that used to be able to just be open, now they have to have alternative methods of sale. So for hardware, for vehicles, parts and supplies, for pet and animal supplies, for office supplies, for safety equipment, you now have to basically order and go pick it up curbside. There's been further restrictions on construction as well, so that especially for the great big commercial projects in Toronto, they're now, all shut down, where you would, these big construction sites where workers would have to ride up on an elevator up, and those are shut down. The part that is continuing with construction is basically any residential construction continues, and that does include seasonal residents or waterfront residences are allowed to continue. Any construction where the foundation is in place, or renovations that were started before the whole COVID-19 pandemic started, can be finished.
All right. Well, Norm, we do have to go to a break. I do want to say thank you for taking the time, and I know your government is doing quite a bit to help locals. There was quite a lot announced today. We could go on for quite a bit talking about that, but we do appreciate everything the government is doing to help out, and I appreciate you taking the time to chat with us today.
My pleasure.
All right. I'm sure we'll hear from you next week as well. We are going to take a quick break, and we'll be right back after this. Are prohibited throughout cottage country and Ontario, and that measure will stay in place until further notice.
The Ministry of Natural Resources and Forestry implemented a fire ban in all their fire zones, and that's a little bit unusual for them to do that across the province in all their fire zones. Fire bans are usually implemented by a municipality or a region or a district based on the geographic circumstances and the weather conditions and the outdoor conditions in the field, if you will. This is a little bit more far-reaching, of course, because it covers the entire central and northern Ontario area. But the ministry felt it was important because of the COVID-19 situation to try and control any risk to outdoor fires at this time of year. And quite frankly, we applaud that. Anything we can do to reduce the number of fires that we're going to helps preserve our firefighters for more serious needs, perhaps, in the community. So actually, it's a move that's being welcomed by the fire chiefs in Muskoka. We really don't know how long it's going to be. The COVID-19 situation is a day-by-day situation. We know it's probably going to be here for the next several months at least. We're hearing daily reports about that situation, so everyone's watching closely. But particularly with respect to the burning situation, spring is a very volatile time for us. With all the dead brush and grass that's on the ground following the winter, it remains particularly volatile right up until what we call green up. And that's when the green grass starts to grow underneath. So the April into early May for sure is a pretty risky time for us. So that we're appealing to everyone to be as respectful as they can to this rule as they have to the other ones, and perhaps even more so. Everybody's doing a great job with physical distancing, washing hands, and this is just another thing that we're going to have to get through this year.
We are taking another break, but stay with us for more after this. Welcome back. On Friday, Muskoka Emergency Services showed their support and gratitude for our frontline medical workers at the South Muskoka Memorial Hospital.
Well, obviously they play such an important role with everything that's going on right now. They are closest to the front lines, to actual people affected by COVID-19. And any first responder, be it police, fire, paramedics, we're all extremely thankful for what they do day in, day out. We've seen this happen in other places across North America, and it was one of our officers who actually suggested we can do this here. And within 24 hours, everybody was lined up and raring to go. I can't overstate how much we're thankful to them for what they do. Honestly, it was it tugged at my heartstrings as we went through there. To see them holding thank you signs to us, I thought was quite incredible. They had a heads up that we were coming, and the fact that there was a large group outside in great spirits, very happy, thankful. They have every reason not to be. A lot is being asked of them right now, and it was incredible to see. I mean, all first responders were in very similar situations. We could potentially be exposed to situations that involve COVID-19 at any moment. We're all taking precautions and trying to take care of ourselves, our families, our friends, but also taking care of each other. And that was all part of this today as well. There's a mental health side of this, and as often as we can pat each other on the back for the work we do, I think we have to take advantage of those situations and make sure we do that.
And we can't say this enough, but thank you very much to all these frontline workers, to the people who's in grocery stores, mail personnel. It's amazing what you're doing. You are our lifeline right now, so thank you very much. We are going to take our last break. When we come back, a recap of today's headlines. Welcome back. Let's take a look at what made headlines today. 2 new cases of COVID-19 in Muskoka, and both have been hospitalized. A man from Muskoka Lakes in his 80s and a woman from Gravenhurst in her 60s, and both have traveled to the U.S. Local officials are trying to push the message even harder, but some locals don't seem to be getting it. Stay inside if you don't need to be out, and physically distance yourself when you are outside. Finally, EMS and police gave their salute to frontline workers, showing appreciation to people that are keeping everything together during this very turbulent time. And you can keep up to date with all the local information by watching Your TV on channel 700 or online and on our Facebook page 24/7. And that's Cogeco News. For more information on the program, head over to yourtv.tv or connect with us on social media. And remember to watch us live at 5 Monday to Thursday. From everyone here at Cogeco News, thanks for watching. Stay home, stay safe, and stay healthy.